We'll just go around the room quickly and introduce ourselves. My name is Hazel Worley. I am one of the. Hi. Evening. Give me a minute. Today's Andy's birthday.
Yes, it is.
Happy birthday, Andy!
Happy birthday, Andy!
And Andy, why are you out there? He always out. He's always out there. Are you with us? Come, you can sit in the back here. Okay, I hear you. I am not mad at you. Sis, would you like to join us at the table? I like, family time.
Yeah.
And we're just gonna do a quick introduction.
And I have to sign in, right?
Yeah.
I'll send this right on over to you.
So I'll begin. My name is Hazel Worley. I'm one of the chairs of this committee, this lovely committee. And I'm so glad to see everyone tonight, Hassan. And if you can just stay.
Oh, yeah, I'm Ro Johnson. I'm a member of CB5. And I am no longer the co-chair of Cannabis Committee, but the Sergeant at Arms on the executive committee.
Yes.
Thank you.
See that.
Thank you. And I just came out just to hang out with my husband, but because I had a coalition meeting tonight, but I just decided to come over here, so I'm glad.
That's nice.
This is something I'm passionate about as well.
Great.
My
Good
mother's
night.
a senior and my grandmother is still alive. I'm 51 years old, but my grandmother is 96. Out here still giving people,
That's all right.
giving
That's all right.
people
Give
trouble.
her the business. Give her
Giving people a business. She lives in Clinton Hills, but
That's okay.
but she's and so senior issues is definitely important to me. So this is my first time coming to the senior committee.
All right, and I am Crystal Matthews. I'm also a CB5 member, first full year this makes. Member of the community and work in the community as well. And legislature. So.
My name's Shani Bell. I live in the community, and this is, I think, my fourth meeting.
Oh, great.
Not yet a member, but looking to be one.
Hi, my name is Kimberly Mormon, and I live in the community. I started coming to the community meetings for number 5, I think February or something like that. So I'm interested in this one because 2 reasons. My parents, they lived a good long time. They're both deceased now, but I was used to being a caregiver for both of them. Like a few years before they passed. And also my son is he's a young adult and he's autistic.
Okay.
So he was in special education like all of his school year and everything when he was younger. I'm looking forward to this particular committee because it has a lot of things that I'm really passionate about.
Oh, great.
Yeah.
Great. Juan?
Good evening, everyone. My name is Juan Colon. I'm board member for our beloved community board. I'm also the co-chair of the transportation committee. And since we are talking about why we are here, a big inspiration for me for joining was my mother has been dealing with dementia and Alzheimer's for close to 15 years now, and she lives in a assisted living facility in Long Island. And so, I'm just trying to be an advocate, not just for her, but for anyone in that kind of situation in our community, so I could connect them with some great resources like the Alzheimer's Association and the like. So yeah.
Good evening, everyone. My name is Sohair Hassan, and I joined the Aging and Health and Social Service Committee because I like that committee. I'm senior too, and I live in East New York for 36 years now. Actually, I am East New York ambassador for community partnership affiliated with Good Shepherd. Okay. Our office is on Blake Avenue and Vermont. Okay. We have so many events, we have so many meetings, we serve the community. We are affiliated with the GREB and Cypress Hill Development Office on Chestnut. So I get really involved in our community. And thank you.
And the
And
gardens.
she's one you do really see out, in the community doing stuff. It's
Good evening. My name is Adrienne Johnson. I am a CB5 constituent. Moved back to be with my mom during COVID, and she is a senior. And so, like Juan, she is dealing with dementia and some other health issues. But my concern always is for health. Period. I'm in the health profession, and so I'm definitely looking to see what else is in my community, because a lot of things have changed and are changing, so I want to just get an idea of what's here. And I'm a part of the community gardens. We have a community garden near our house, so I'm part
Which
of
one?
Positive Seeds.
Which street?
Oh, I'm sorry, Seneca Avenue, between Newport and Riverdale. We're right on the tail end near the train station.
Mm-hmm.
We're still CB5, but it's right before you get to Brownsville, so some people think we're on the Brownsville side, but it's on this
On the
side.
border.
We're on the border.
Okay, perfect timing. You're up next. But I'll give yourself a minute, and then I'll introduce yourself and you on the agenda for tonight. So, the first item on the agenda is the co-chair Mitchell's discussion on meeting with Vandella Older Adult Center. So she's been partnering with this center. We want to collaborate with them and do some project. We do a lot with Penn Workman, and we want to spread ourselves out to the other senior citizen centers in our community. We have about 5 or 7 senior centers, older adult centers in our area.
We have about 7 to 8. Some are under renovation.
Right. So I was right. We have 7. So what we are trying to do is, get involved with them. We have annually, for those who don't know, information and education day with the one on Linden Boulevard, Pink Houses, and it's a full day. I'm sorry, Teresa Moore Center, and it's a full day. We go there. We have different agency, New York City agency. We have the Department of Aging. We have Health and Social Service there. We have the fire department. We have the police department, the DA. We have a whole lot of agencies equipping our seniors with information on protecting themselves, and we have a great time with them. So we're gonna move on from this and let Andretta, when she come back next month, to speak more on the Vandella Older Adult Center and what her plans are. So the next thing is the event in coordination with the Penn Workman Older Adult Center in May. Can you introduce yourself, Ms. King?
Good evening, everyone. My name is Tasha King. I'm from Penn Workman Older Adult Center. I'm actually one of the program directors at the center. We provide services to people 60 years of age and older. So anywhere between 60 to 99. We have one who's 106, but she doesn't get out that much, right? So our goal is to help decrease social isolation in the home. So to get our members to be able to come out and be active in the community. So we offer a plethora of services, whether it's in the area of physical exercise, in terms of arts and crafts, in terms of health management and education, in terms of blood pressure screening, which we have Crystal Matthews here from Rise Up East New York, and she actually comes out and does the blood pressure. With Community Board 5, we started, now it'll be our 2nd year with Community Board 5. Our director here, Ms. Hazel Worley, is on Valentine's Day. And last year, she took a trip to the older adult center. She said, I want to
No, it's not. Also the year before, don't skip me. It's the year before.
So it's
This is 2 years now.
Right, this is the second year.
Yes, ma'am.
Right, so she came in. Oh, we came
Yes.
in last year and stopped into the center and actually registered.
Yeah.
And she said, you know what? It was a day of love. It was also her birthday. And she said, I'm going to collaborate with you.
Yeah.
So this year, Community Board 5 hosted a wonderful
Yeah,
Valentine's
yeah.
Day. It was called
Yes.
Sneaker, right? So we had my
Uh-huh.
love and sneaker day ball.
Yes.
So you got to wear any kind of shoe footwear you want. They got to model. They had
Yes.
a game book. They had
Yeah.
flyers,
really
they
nice.
had
It was
treats.
a nice day.
It was just a really great day of love.
Yeah.
Still
Yeah.
talking about it. Right? So with that, Community Board 5 is actively engaged in the older adult centers
Yes.
of East New York, Brooklyn. So we are happy to have you come out. I do have a calendar for the activities that are going on for April. And what we're looking to do is for the month of May, see how we can collaborate. Whether it's, and we want to do something for all of the women, but empowering our mothers and our women. So that's what we're doing behind the scenes to see if it's going to be a Mother's Day tee or a Mother's Day hat or Mother's Day scarf or, you know, whatever the theme is. We really want to hear and pick the brain of Community Board 5 to see what we can catapult off the ground for Mother's Month. So that's why I'm here.
And if I can add, if you can just browse through the calendar. I mean, not because Miss King is here. This center really have a plethora of stuff to do. You as a senior, your loved ones, whoever you know. I mean, if you can get them there, this is a fabulous center. I mean, I was there last week. You know, they have line dance classes. They have, a lot of activities, and they don't just throw stuff together. They put it together real nice, really nice. Okay, we're gonna move on.
So I had a question. So how do you register? How easy is it to just walk
The
up?
person just has to come in.
Yeah.
Between the hours of 8:30 to 2:30 for registration, right? Because we like to take time to give them an actual tour and show them the facility. Most times if a person calls, we're gonna tell them come in by 9 o'clock or so. Why? So they can get to have breakfast with us as well. Or if they want, they can have lunch. They just need to bring one valid piece of ID. Not be 48 trying to sneak in. That's my corny joke that I've been saying for 3 years. but
Yeah.
Don't be 48 trying to sneak in, but be 60 years and older. A list of their medications, an emergency contact person. We get them signed up. It's not like a social day hab or other programs where there's Medicaid billing or anything like that. So it is one of your traditional older adult centers. So it's based on identification. Breakfast is $1.50. Excuse me, breakfast is 50 cents. And I also have, I do believe, copies of the menu. So breakfast is 50 cents, lunch is $1.50. And when they register and sign up the first day, they don't pay. And we do it like a big shout out, welcome to the family, and behind that.
Thank you.
Yes.
Do they have to live in a district?
No.
Mm-mm.
No, they can live any of the 5 boroughs. We have people that live in Long Island as well who come out.
Mhm.
Yeah.
Very nice. Very nice.
How about transportation? Does the family have to get the person there, or do you have?
They have to get the person there, but if it's in a 2-fare zone or out of the encatchment area, or if the person has some mobile limitations, we do have a transportation program. But we only go within a certain area because of how many people. Our transportation department services 3 programs. So that's Penn Workman, Vandalia, as well as Abe Stark. So they have to be within a certain zip code zone.
But if they have accessorized, they can just.
Yeah.
If they
Put the
have
address in?
accessorized, they can put our address in, and if they don't have accessorized, we get them registered with accessorized. So we do what you call case assistance. So right now, for example, we've been doing a lot of accessorized applications. and no one's been denied so far.
Mm.
And I'm gonna say no one's been denied. I mean, take out the so far. And we are also doing for Department of Motor Vehicle, those who want to get the real ID and enhanced, they do registrations for that as well. So we do all type of case assistance, you know, different scenarios we try to accommodate.
Thank you. Do you have I want to say like a memory care program, or is it for people who are a memory care? Do you have anyone there for memory care?
We don't have anyone for memory care, but we do activities that we do, like we do music in memory. We also have the Alzheimer's Association. They come in regularly. So we have a partnership with them as well. So they come in, if not, like every 2 months or so, they'll come in as well.
We good? That's it. Okay, we gotta move along. Crystal, you have?
Sure, yes. So Shannon and I have been working to put together the mental health assessment.
Okay.
I have copies here. This is a draft of what we've put together thus far. We want to be able to have you all take a look. And we can go through it together. You have over there. I'm so sorry. I just can't put the right on the screen. That's me. Yes, and Mr. King back there as well. Oh, I heard that his name in the corner. So we can kind of go through it now. If we find or think that it may be a little lengthy, it's something that
Can you just give us? Can you just give us some background on why you ladies are working on this? Where did this give birth from? What's the
Yeah, we were
behind this?
asked to identify what the concerns are for people, seniors, I think it was everyone in the community, what their general concerns were, especially to do with mental health.
Okay.
So, yeah, this is our first draft.
right. So it's the first draft of it. You know, it goes over age, gender, if people choose to say occupation, the education level, what their current living situation is. I think it's just a matter of really getting to the crux of if there are any mental health concerns, if resources are needed, those things that might be there.
This is the same.
So some of the questions are if they've been anxious or depressed, hopeless about the future, overwhelmed, do they feel they have someone they can talk to? If they were considering a therapist or mental health services, was there something that was preventing them from it? Be it cost or stigma, some of those things. So hopefully it'll allow us to really get to the heart of the matter when it comes to people and their mental health concerns. This way we'll know where we need to go from there, I guess, in terms of providing resources or being able to offer resources to those who are here in the community. So as you said, it's just a first draft. So it's open to suggestion if there are things, we all think there are things that should be there that aren't there. So that we make sure if it seems like it's a little too lengthy, we can always shorten it. But we just want to make sure that there isn't anything that's left unaddressed.
And who are we targeting to do this?
I think it was the entire community.
The community. Community, how are we getting this out to the community?
That was a good question. We've still been, I think we've still been talking about it,
Okay.
but there's a day that's coming up in August at Gershwin Park.
August 20, yeah,
the
okay.
next one.
Ooh, you took it right out of my mind, okay.
Segued right
that's-
into that.
Oh.
That's where we're gonna go into. If y'all wanna finish and then we could talk, because I think this will be awesome. This will be awesome on that day.
I think that was
Bring it
the
home,
plan
Crystal.
right there.
Yeah. So,
That was definitely the plan. So that's why I said
Yep.
we need to flesh it out some more if need
Mhm.
be. So be it, and if we need to get the Department of Mental Health Services to have those resources that are available that can tie directly into the assessment. So this way people are able to show up and identify with what those needs are. Hopefully there will be services that are right there that they can speak to and get in real time.
It was also supposed to be used for the report. I know it's not called a report, the assessment that we have
The
to
needs
do.
assessment.
The needs assessment, it was
Yeah,
supposed to
yeah.
assist with that
Yeah.
as well.
okay, so I'm gonna jump ahead and I wanna talk about the August 23rd, Gershwin Park event. So this is gonna be a big event for our community, not just, hold on.
Yeah, she had a question.
Oh,
Oh,
you had a-
yeah, I mean, I was just gonna mention it in new business or something, but for this, if I could make a suggestion in addition to what you're doing and doing it at the event, maybe putting it into a Google form so that, you have the,
You're right. I just
you get
made
the
note
back
of
end
that.
of all that data,
Yeah.
especially so it turns into something more like a clinical study. as well.
Absolutely. Thank you. I just actually made a note of that.
Okay.
Yeah, thank you for that.
Okay.
Just a thought.
So when they doing it in a Google form, go a little more in detail. So when they go and
Oh.
do it into a Google form,
So it'll be completely anonymous because they'll be
Right.
and it'll go, the back end of the Google form goes into a spreadsheet.
right?
So they'll know how many people, like all the ages,
Mhm.
and they can sort the information, the data by age, by gender.
You're talking about like tallying it up once we got these back, or that's,
Yeah, but it goes into a spreadsheet. All
Yeah,
of the
okay.
data will go into a
that's what
spreadsheet.
okay. I'm with
So yeah,
With you.
like so the person on the user end, they just fill it
Yeah,
out.
yeah.
But
And then
then-
when we collect them back, yeah, I was
Yeah.
gonna go there.
I was,
After,
okay, go ahead.
no,
You said it
you
was
go,
after?
Crystal.
Okay.
Yeah, because I was gonna
hoping
think
that
in how we
there
gonna.
may be a way in which I know we can have tablets or something where we can collect the information in real time, so we don't necessarily have people walking away with a form that we might not get back.
Yeah.
Or,
What if-
or
uh-huh.
we can ask, because my vision for this committee for that day is we're gonna have a table. There are gonna be these forms available. We're gonna have people standing there and asking them to fill out the form. Can you take 5 minutes? We're gonna gather. It's total confidential. I like how you don't have names or nothing. And we get this information and we gather it, and then we tally, like she said, and put it on Google form, and we can
Okay.
come back to it. This is really good. This is really, really good. And I think if we get a group, because we're gonna do some recruitment also. We need to have this. We need to have people on the grounds with this.
I will say we have Maxwell, we have Thomas Jefferson. Maxwell has a nursing program. Thomas Jefferson, I spoke to Sheila Tomlin Reed, and she was
Yeah.
saying they have a nursing program at Thomas Jefferson as well. It's perfect to get those students, even though it's during the summer, get those students involved because they need to be, especially that age. They will
I'm
need
gonna
help getting to the
I'm
table.
gonna put this down as
Yeah.
assessment, because I'm trying to put together like what we are gonna do that day.
Okay.
So we're gonna do mental health assessment forms. Everybody can keep mental health assessments. I'm listening.
2 questions. Again, in the spirit of HIPAA, is there a way that, I'm not saying that we want to hide necessarily, but even when people are doing this, people can still be looking over their shoulders. And so
Ask
is,
them to space out.
but even, I guess what I'm thinking too is like when people don't get their vaccine, when we did the COVID vaccine, it was just like a way that they walked into a space and the people were getting their shots and then walked out. So they had screens. I'm just thinking,
Like partitions.
exactly.
It could be like a little.
Because this is really, I mean, this is, whether we like it or not, this is still somebody's public health information, whether they're still putting identifiers in there. And so we're not putting names, it's right, but you're still, it's in the open, it's in the space, wind can blow everything.
Right.
So I'm just thinking in terms of, protecting HIPAA. And my second question is there any connection with the Department of Health? Because I know the Brownsville campus used to do mental health training. And is there connection, because this is a public health issue as well. Has there been any invitation to facilities in the neighborhood that are doing or that are addressing the same area? Like, you don't want to seem like you're being redundant, but it's just, are there other health facilities that we can collaborate with so we're not kind of reinventing the wheel?
So let me just
with
say
that.
this.
Mhm.
Our co-chair, Andretta Mitchell, Dr. Andretta Mitchell, that is her field.
Okay.
And she's always having information and stuff. So that's who the person we lean on.
Okay.
Because right now, right here, what I have, that aging health and social service at our table, we want information on mental health services. We're gonna do the assessment forms. And now we're going to discuss who else do we want in our area. thought of the fire department. I live in East New York, and we have so many fires in Starry City. So FDNY is one of the city agencies. Of course, Department of Aging is another one we want to have there that day. Any other suggestions?
Um, if I can just tie it back in,
Mhm.
thinking about the mental health, Interfaith has an adolescent mental health department. I think it may be good to have someone there who can talk about young people and their mental health as well.
Interfaith
Interfaith, yes, they have an adolescent mental health
adolescent.
department.
And I don't know exactly where to put this, in what bucket to put it in, but something that people really don't address and I want to talk about more is mental health with perimenopause and menopausal women because it's a thing.
It is a thing.
It's a thing, and it doesn't really get enough attention.
Absolutely.
And so,
Absolutely.
some kind of expertise or advisement in that capacity.
So I don't want to steal too much because that's also what's the committee Andretta is head mental health and something. That's a lot of her area too. It's
Health and mental health.
health and mental
Yeah.
health.
Okay.
That and they are the ones that's actually hosting
What's in
this.
it? Okay.
So I don't want to take too much, but I'm gonna make note to her. But these assessment forms are in our care. Just
Can I
thinking
just-
mental health services. I think they're gonna be the one to provide that.
To your point when you talk about the privacy and the HIPAA and all of that stuff, if maybe there's also collaborating with the hospital or whatever, if there's a QR code where they could do it on their phone, that might be something that could give you the measure of privacy. So just a thought, just an idea, just a thought.
But you know, this is just my opinion.
Mm-hmm.
I think that one-on-one, because that day people gonna come out.
Mhm.
A lot of these people ain't been out probably days, weeks, and months.
Mhm.
And that one-on-one, having a conversation, I think people
To get the
kinda,
services.
yeah, people
got you.
kind of would
Yeah.
be okay with doing this. Because a lot of people stuck in their house. They don't have no social life anymore because of whatever. I ain't gonna say COVID, but I think this. I love this. I think this is gonna go over very well. We just have to tweak how we're gonna do it, and we discuss it more when Andretta come because I don't want to take too much from her and her committee because that's their area of mental health. So for us, let's backtrack a minute. Go ahead.
I do agree. The QR code is not working for the day. Maybe people can go home with it because
Yeah.
even after this event, we would still want this information.
Yeah.
Right.
Okay.
Right. That'll be
Just a
good.
thought.
Okay, I'm just looking at some notes. Okay, so yeah, this is a big event on August 23rd. Please, everybody, mark your calendar because you know how, I don't know about y'all, like when mine's packed up real quick. Because this is a collaboration event with CB5, 75th Precinct, and East New York vendors. So we're gonna have vendors. It's gonna begin with a prayer walk led out of the World Missionaries. What? Led by Out of the Walls Ministry and Community Clergy. More information on that to follow.
Do we have a start time? I'm so sorry. Just one.
I'm gonna say
No
8
worries.
o'clock in the morning.
Okay.
We gotta be out there 8 o'clock.
Okay.
So committee, what other agency or who else would we like to be inviting on behalf of the Aging Health and Social Service Committee? I have Department of Aging, FDNY so far.
New York psychotherapy group. But do you think is that encroaching on?
Yeah,
Dr.
and trying to,
Mitchell's- okay, I'll leave it
yeah.
at that.
That's what I'm saying. I'm trying to come away from there. Somebody,
I think
you know who would be good that we could get out there? Sis girl, King.
Yeah.
If we could get Darlene out there, do line dance.
She usually comes.
So she coming
a
from
regular.
us.
Okay.
So Darlene is gonna be there doing line, cause that'll be on our entertainment. Darlene will do line dance. Anybody that you could call on to do exercise?
I'll check into it and get back to you. Like,
Okay, King.
Under exercise.
We've had girls who do line dance. We've had people that do physical. So they've done a mix of either the chair and also the mobile, just the stand up. So we've had,
I can check ahead and see if
I'm part of that group.
Okay, so I'm gonna put exercise King and
What
Day is that?
August 23rd.
That's why I was just telling
She just told me.
That'd be good.
Ashley, I put Ashley right here.
Did you say the department for social services already?
No, what would be the point of them coming out?
Everything. They can provide resources for social services in general.
And they're 1/3 of our committee.
That's a sticky because with them, it's all these red tapes and qualifying methods that you have to go through for social service. You're talking about, right? Public assistance and yeah, I think that's
It could give advisement on how to do spend downs and relevant
that's Department of
information.
Aging.
Oh, okay.
That's why I have Department of Aging because we focusing on aging, so people who already have the and Department of Aging covers those kind of areas.
Maybe flyers then from them. I think they must have something that we can use or information for the people that are coming.
Yeah, those two, all three of the agencies are so interconnected.
Yeah, they are. That's
So it makes sense to have them, all three of them, be present.
Do we reach out to the Department of Aging, or that's
yeah, we do.
okay?
Yeah,
And we have liaisons with all of them.
Lawrence, right?
Is that the department for the aging, or is there something?
Yeah.
Yeah.
The department for
The
the
aging.
Oh, yes.
Yeah, that's yeah.
Yeah, no, they're ready. Yeah, they're good. They're good.
Yeah.
Okay, so the only New York City agencies we have right now are the FDNY, Department of Aging, and anyone else.
You want to do Office of Emergency Management?
Yeah, that's true.
They've come up.
Emergency bags and emergency kits and things to help set
That is so true.
Anything with financial release?
That's, I was gonna say, financial, like, estate planning and, also kind
You
of,
mentioned that last
I forgot, I think it's consumer, I was just looking it up, like which division is it, but, to keep people, like, to watch out for scams and stuff like that.
The DA's office do a great thing with that.
Yeah.
The DA's office, we should have them too.
Estate planning and,
It's, the,
The DA's office does a great thing with that. I forgot about that.
We did
I
mention
think something
estate
with-
planning last time. I did mention that I do estate planning as well, so if I can bring resources for
Estate planning? Okay.
Yeah.
That's great.
Yeah, that would be easy for me.
So this is a senior day, then you're strictly.
It's community.
Oh, it's community.
You said estate planning.
Yeah, I'm an estate planning attorney.
Yeah, we just had a situation in my building. It's like sticky. So so important that people don't understand the importance of these things. Okay, so I think we have a great start. We do have a great start here.
it's consumer affairs.
We want to make sure, and then we have figure out some other little stuff. Maybe we can gather up some stuff and do some giveaways. I always, that always grab people.
Yeah.
When you come up,
Say there's
Hassan
enough
is
time
great
to-
for that. Huh?
I was just gonna say, you're right, there's enough time for that. to
Yeah,
get
see what
those
we can get from
donations
maybe Rise Up, if you guys
and
can
the
do
blood
it.
pressure kit, like showing people, some doctors don't usually give them out anymore, but.
Blood pressure kit, they give them away. Yeah,
No, but what I'm saying, we have like a health thing that's coming up in June. But we started reaching out to pharmacies and the companies
Oh, any
and asking them
leftovers?
for.
Any leftovers? You know, you guys have a nice little kit that
Right.
had
Yes,
The,
those kits.
with the
The hygiene kit.
the hygiene with the toothpaste and the
Yeah.
And me and Miss Hassan, we always get together. You know, we always like to have like goodie bags.
Yes, I like that.
It goes a
Yeah.
long way.
And you know, the health department around here, like the one on Blake,
Mm-hmm.
they always have table over there.
Anything you can pick
Surely,
up?
what's the name of that center? Is CHM. It's on Blake 999 Blake Avenue.
Oh, okay.
Yes.
Oh, she said the Shirley Chisholm.
Yeah.
Thank you, Miss King. Okay. Okay.
They always.
So I'm gonna put down all.
And you know they give.
We
this
want
medicine,
some gift bags.
Container Monday, Tuesday.
Oh, the pill boxes.
Yeah. People like that.
Yeah, but anything you see you can get.
Yeah. Okay.
And then you know how we do. We come together and do little goodie bags. Get some, some little cookies, whatever we come up with,
Yeah.
and fill them up. Because people like, and that grabs people. They see guys
To come more. Yeah.
to come to our table, to sign in, and that's also going to be used at a later date for recruitment, which I'm going to speak on now. We need to huh? What do you mean? Anything from them?
Well, you were talking mental health, so this is generic, this is male or female.
Yeah. Whatever we get, basically, whatever donations we can get to put in the bags, that's what we do. What do we do? The one at Pink Houses we did. I keep calling it. What's a Teresa Moore Center? We did. We had nice bags. We had somebody to donate some male products, colognes and stuff, and then we had the women. We had a lot of nice stuff from. Remember when we did?
Yes, I remember.
Yeah,
I remember,
and we added water, and we had some granola bars. We had some cookies.
Yes, I remember.
Yeah, well, that was really nice. Those bags, and it was pretty nice bags. And we got stuff from Emblem Health. I think it was Emblem Health. Yeah. No, what's the other one everybody's going to?
Gotham?
No, not Gotham. Huh?
Oak
Street Health. Yeah, they gave us quite a bit of stuff. They had some nice
That's
bags.
early enough to ask them.
Yeah.
If
I
that
know
question.
asked about city agencies, but I know Con Ed a lot of times comes in tables and National Grid, and they always have little tchotchkes.
Oh yeah,
That
Con
is
Ed.
true.
When they
Con Ed, and you said who else?
National Grid,
National. We're gonna need 2 tables.
but also for social services that kind of guidance on how to apply for HEAP or
And that's still Department of Aging. They does that too.
okay.
I would try, but yeah. Department of Social Services is a hiccup.
Okay.
It's a lot
All
of.
right.
They are not like they used to.
Department of
be.
Aging does scree
I
applications,
was just
scree and
But yeah, those,
scree and
those you can print, Dree and Scrape.
scree and scree. Yeah.
What is that?
That's when you it keeps your. I had to do a whole fight for my mother because her building tried to raise her rent by $850 one time. And
Yeah,
yeah,
a rent
and
free.
they give
So
you like a
what
rent
the
free.
rent is, the
Yeah.
person would pay based on their income, they would pay a certain portion of
Okay.
the rent.
Yeah.
So as the rent goes up, their amount would stay stable.
They,
Yeah.
yeah.
So it was stayed at an affordable rate. So
Okay.
three is for senior, exempt, basically it's a senior exemption on how much they contribute, and DRE is if they're disabled.
Yeah.
Okay.
Yeah.
So
But
landlords
so
have to be able to
Who was
accept
they
it.
under?
Department of
it's
Finance.
yeah. But a lot of people don't even know about it,
That's
and especially with all the rents going up on old
Yeah.
people.
Department of Finance.
Yeah.
And actually
And
for
it's
tax,
called, hold on, I need to write, what is
it's
it called?
it's SCRIE. And actually the
SCRIE.
yeah.
And it was another one you said.
DRIE.
Those
Now,
applications are online
is
though.
You can't live in a NYCHA residence.
Yes.
Yeah.
That's
Okay.
what they call
Or so the other thing is
Or Mitchell Lama, or
Yeah.
like different things like
or
that.
anything where you got it from Housing Connect, then it makes it invalid. But if it's
Okay.
not, if it's like regular apartment.
Yeah. Oh, great.
And the other thing for the tax lien, like tax liens or tax sales, like kind of any kind of services advising people how to get off of the tax lien list. Because it's usually our senior citizens that are.
And who are we reaching out for that?
I think that's the Department of
Department of
Finance as
Finance.
well. Yeah. But it's usually our seniors that end up in tax trouble but don't know how to get out of it.
And they're gonna be there for what? Tax lien?
Tax lien, yeah. Or tax and water bill, like you're taxing your water bill.
Tax and what about
Yeah.
Okay, so we got a nice
Services.
bit of things going on. Okay.
Anything for nutrition. Nutrition.
Other co-chair, she was mentioning it. What's her name? Was she the doctor? The one she was
Dr.
getting
Mitchell.
Mitchell.
Yeah.
Oh, right.
Yeah.
She was saying she has a lot of information.
Yeah, so we're gonna leave
that she
that.
wants to do with-
Nutrition, I'll just put it down.
Mhm.
And these, we're gonna follow up. If anyone have any information, you know where we're reaching out to, Con Ed, National Grid, Department of Finance. I could do FDNY and Department of Aging. Office of Emergency Management. If anybody wanna help, please, by all means, let me know who you're gonna reach out to. Cause this is a team effort. So all help, all hands on is great.
Emergency, I'll tag team with you, and also Department for Aging, we have our program officers.
There you go. Which one?
So Department for the Aging is
You.
NYC Aging
Yeah.
and OEM, Office of Emergency
Okay,
Management.
so I'm putting you down. I appreciate you. You was always a help.
And the fire department, is that the one on Sheffield?
Yeah, I have that information on it. They was Department of Aging is king. Anybody want to take on Department of Finance? Okay.
Too much. Never mind.
I know some people that work for the department, so I can put. All right.
Is there having any health care? There was a Gotham or one for health. Are we?
They probably like I want to stay like in our area.
No problem. That's what
Yeah,
I was
but
just
I believe so. And like Andretta is spearheading. She's one of the top spearheaders. So I don't want to get too much in when she's here.
All
I
right.
will in next month. We can go. Just let her know what we came up with for our committee.
Gotcha.
The next thing on the agenda is recruitment for new members. We need a secretary and a sergeant for this committee. So at the membership at the community meeting next month, myself and Andrew, we are gonna do a call out to try to recruit new members. But if anyone here is interested in being the secretary or the sergeant at arms, we would really appreciate that. Okay? Anything else? You know, I don't like to be here all night.
I have some.
Oh, 7:25. I do have a question for you, Juan. So the dispensary machines, it was been on my mind. How, any update on those machines? And if you could go in detail and tell everybody what machines I'm talking about are.
Yeah.
Oh, is it? Okay. Okay. Yeah, we have it.
You good one?
No, yes, hold on. We're just looking for something. No, I thought I had the information here, but yeah, what you're referring to is the the
The vending
health, yeah,
machine.
the health vending machines.
Mhm.
There's one that's located on Pitkin, close to the Euclid A train station. It's on the outside of a clinic. It's actually right outside of a pharmacy attached to like a nonprofit in Pitkin. And yeah, I went during the winter. Well, no, I went. I think the last time I went was in January or February. What is time? But yeah, I went, and yeah, I just randomly picked an item. You know, they offer items like sanitary items, materials for safe drug use, things like that. And all you do is just punch in your zip code, and it just comes out. Yeah, and then I grabbed a random bag just to see what was in it, and then I filled out this survey. Every little thing has like this little survey. These are maintained by Vocal New York. Right. Yeah, and it was, yeah, and I just put in what I thought, and yeah, just some comments that I had at the time, but yeah, everything seemed to be pretty. It was like the day that I went, it was like half stocked, and they usually fill it up about twice a week.
Okay. So they are still keeping the machine
Yeah.
well stocked and
Yeah.
clean.
Are we planning to invite them to our committee before the end of this session for like
Yes,
status?
just for a status, yeah. So,
So we're thinking like May or
what
June.
was the age, what was the name of the?
Was the Department of Health and it's
Department of
and then Vocal NY.
Yeah. They came before us, speaking about putting these vending machines, the vending machines have like condom, what's that when they do the Narcan kits? And they was talking about where they wanted, so we went, through a lot of conversations and educating us on, what's in the machines and where they're gonna be, so our committee choose to, one, spearhead it. Just keep an eye out and see if they're gonna stay to their word. So far sounds so good. So
Yeah, and I try
we can
to
have them come back. Yeah.
yeah, and I try to have like random conversations with anybody that's willing to talk about it. And I also talk to the pharmacy folks just to see how the traffic is and things like that.
Then what did the pharmacy do?
Yeah, I mean they say that people use it. You know, they come in. Sometimes they go in to ask about it, but they don't. The pharmacy doesn't have anything to do with the vending machine. It's just directly outside of their space. But yeah, a lot of times, yeah, some people just ask like what that's about. So yeah, so that was that. But I did have something for new business to share. So another organization that I work with is the Linden Houses NSTAT team, which is a group of residents at select NYCHAs throughout the city, and they are chosen due to public safety statistics. And Linden Houses is where I live for the past 8 years, and I just joined their group in the fall. And yeah, it's just about just empowering residents to support their neighbors. And what we decided to do, it was kind of like a split off of what the event that we were trying to do with Rise Up. But this past Saturday, we wound up doing a mobile prostate cancer screening
Oh, nice.
with Mount Sinai. the bus pulled up, and so what we did was we were asking men 40 years or older to do a assessment. Actually, I did it for the first time. You may not look it, but I am 43 years old, so I just wanted to be able to tell people, you know, it takes longer to fill out paperwork. All this is a blood draw, and then I get a call back in a week for the results. But and then what we did was we partnered with a local church to have food donated. So it was like, do the screening and we give you like a bag of groceries, pantry stuff, fruits, vegetables, that kind of thing. And yeah, it was great. Like they brought out a lot of food, but the weather, if you guys remember, on Saturday it was pretty miserable. And our location was on the Stanley side of Linden Park, between Vermont and Van Sicklen. We were there from like 12 to 4, and yeah, I think we got like over 20 folks to come through. We're aiming for like 50, but yeah, like I said, the weather was working against us, but yeah, I have extra flyers if anybody wants to grab one. But I think this is definitely a lot of the folks that it was 1, 2, 3, 4 members part of the mobile unit, and half of them live in the area. So it was cool to have folks that were working that know the area, and yeah, they really had a good time with us, and they definitely want to continue to work in our neighborhood, and this is definitely something that I think our committee can reach out to.
Can you take the lead and reach out to them for the 23rd?
For August?
That would be great to have. I was thinking about them and the mammogram screening trucks.
Yeah.
So
Yeah.
can you do that?
Yeah, I could reach out to them. And it's actually good timing because September is Prostate Cancer Awareness Month.
Yeah.
So this is like the lead up to that.
So I'm gonna put you down as you're gonna reach out to them. But that will just be really, really good to have.
Yeah.
You know, Lady M and beyond that is awesome.
Yeah. Yeah, no, it was a lot of very interesting conversation that I had with folks around the neighborhood about this topic. So it was really interesting experience for sure.
Anything? Hold on. Go ahead.
For new business, I just wanted to point out that we have on the cannabis and review committee, I have some down there too. We have a whole campaign. We had the
I have one.
Brooklyn North,
Thank you.
the task force, and the 75th precinct. We're liaising with them to make sure that we have the addresses of all the unlicensed shops. There is not one licensed shop in East New York. We're working to get a licensed shop here, but in the meantime, if you see a cannabis shop in East New York, it is not licensed, and we're trying to shut down the unlicensed market because for a variety of reasons, they're putting a lot of junk in it, and they've been testing it, and it's you wouldn't even believe some of the stuff that comes off at the test. So and so that we can get a licensed dispensary in the community so that we can shut down the unlicensed market because there's a lot of drama with the unlicensed market.
The one that was at the base of Jackie Robinson is gone.
Oh, that one is gone, but they're like, it's like whack-a-mole.
Yeah.
And then a lot of times they'll shut them down and they'll camp out outside and be like old school. Like that's just their location.
Yeah.
So we just need a vigilance that is like just more like ready to jump on it. So we've given the back end of this. This is a Google form. And the back end of the form is going to the Brooklyn North Smoke Shop Task Force and the 75th Precinct. And they said this is perfect because it gives them the addresses to see what's going on.
And they can monitor
Immediately. So I'm just making sure that every committee has it so that they know how to file the 311 complaint, but then also give us the address so that we can kind of jumpstart, because otherwise we have to wait for the 311 system, and then it goes to the sheriff, and then the sheriff goes to the precinct, and it's just too convoluted and long, and this kind of circumnavigates some of that.
Okay,
So if anybody, there's some down there, but if anybody wants to.
with all hearts and minds
Thank you
clear.
very much. I used to meet
I don't be
you.
long. You don't have to be long.
What happened to you, Sue?
I had to work during that time of that meeting.
Yeah,
The COVID
because
meeting.
I don't receive any emails or any link to join you
Oh,
anymore.
I'll tell Haley. I'll tell her.
Yeah, tell her, let me give you my
'Cause I had a
email.
meeting with them
I
today.
think I have it, but
Okay,
let me give it to you.
okay, here, yeah.
All right, ladies and gentlemen, it is exactly 7:37.
I can't, you
Thank
take a
you.
motion to adjourn.
Executive.
Sounds like you, no, I can't, cause I'm not a member of
I know.
the committee.
Well, I will entertain
The motion,
a motion,
and I second it.
and there we go.